Hi, my name is George Torys, and I'm the First Link Coordinator at the Alzheimer Society of Toronto.
My name is Maria Martinez, and I'm a social worker in the University Health Network Memory Clinic.
So hello, my name is Lee Ringer, and I'm a clinical nurse specialist at St. Michael's Hospital, and I work on the internal consultation team in geriatrics.
Hi, my name is Laura. I'm an occupational therapist at the GAIN Geriatric Clinic at Scarborough General Hospital.
As the First Link Coordinator, I try and connect people in the community that have Alzheimer's disease or another dementia and their families and caregivers to resources. Could be counseling resources at the Alzheimer Society of Toronto, or joining a support group, or perhaps an education program.
The Memory Clinic is an interdisciplinary team of different physicians. So we have behavioral neurologists, a geriatrician, psychiatrists, and social worker, OT, and nurse. So it's a different group of people that come together to assess people's memory and thinking.
A lot of the patients that I end up dealing with are individuals with some sort of cognitive issue. A lot of the times we see patients at the early stages when they haven't been diagnosed yet with the diagnosis of Alzheimer's disease or another sort of dementia. So we're the front line that's actually doing the assessments and that are making the diagnosis.
So the First Link program started in Ontario back in 2005 in the Ottawa area, and the way it came about was basically we realized that people weren't being connected early enough to resources. What would happen is that we wouldn't necessarily see them until they were in a crisis situation. What we're trying to do is we're trying to alleviate those situations from occurring. We're trying to help families by providing them education earlier.
I use First Link at least 2-3 times a week that I refer my family members or caregivers. Just now before I met here, I referred a family member to First Link, and he's a young man who is caring for his mother who has fairly advanced dementia but is managing all the money in the family and including the family business and making poor decisions. He's overwhelmed, and the person from First Link will be able to talk to him and talk him through the options for financial capacity. The other thing is he doesn't really have an understanding of what dementia is, and he's getting into a lot of arguments with his mother, trying to understand why she's making poor choices or not remembering his name. And I know the person from First Link will help him to come to an understanding.
So our partnership with the Alzheimer Society of Toronto has actually grown quite a bit since I've been here. It's an amazing partnership, probably one of the strongest that we have here at the clinic. We feel very comfortable referring to the Alzheimer Society of Toronto because they're so good with communication and letting us know how the patient has been contacted and what kind of services that they've been offered. So we know if when they come back for follow-up, kind of the link that's already been made with the Alzheimer Society. Specifically with the First Link program, we find it very helpful at the initial diagnosing stage because families and patients are very overwhelmed by the diagnosis.
The ideal process for First Link would be a family physician making a diagnosis of Alzheimer's disease, and then they would get permission from the person with dementia or their family member or caregiver, and once they get permission they would send the referral to us, and then within 24 to 48 hours we would try to make that initial call to the person that was referred and start the conversation and start providing them with any help or information that they might need.
For us, it's really important to make that referral because people can become quite overwhelmed once a diagnosis is given, and because a caregiver has so much to do already, asking them to contact the Alzheimer Society may be a bit too much, so having a counselor through the First Link program contact the families is probably the most ideal situation.
We use it on a daily basis. I would say probably at least a couple referrals go out every day, so we find it to be extremely helpful, and we're very appreciative of the partnership, and we find that it's only going to get better from here, and there's a lot of opportunities in the future, so we think it's going to get bigger and better, our partnership, and hopefully serve a lot more people in our community.